Hello and welcome everyone. Uh, so this will be the second in a series of two webinars on the implications of COVID-19 pandemic on the mental health and substance use, being organized jointly by ISSUP India and ISSUP Indonesia. As we all know, many of us have personal experiences with how this pandemic has affected everyone. We all were witness to the devastating second wave of COVID-19 epidemic in our country earlier this year. And while the health implications and social and economic implications of this pandemic are often recognized, what is not given due emphasis is the mental health related issues arising out of this pandemic. So this, of course, is a very relevant topic for us, especially people working in the field of mental health, to discuss and deliberate on, so that we can devise strategies to deal with the negative psychological implications of the pandemic. We understand that because of the pandemic, there has been a lot of stress, lot of fear, social isolation, a number of other issues, because of which there has been increasing level of depression, anxiety, sleep-related issues, post-traumatic stress disorders. Also, there is some evidence to suggest that the use of psychoactive substances, particularly alcohol, has increased during the pandemic, which may be associated with some other social issues like domestic violence. So the second webinar of the series would highlight the possible reasons for these developments and is trying to bring attention to these important issues. We have a panel of 4 speakers for this webinar, and they will all be talking about some important aspects of the implications, mental health implications of the pandemic. Our first speaker is Dr. Katya Ratnadilok. She is the Director of Justice Research and Development Institute at the Office of Justice Affairs, Ministry of Justice, Thailand. She holds a degree in clinical psychology with a concentration in neuropsychology from Widener University, USA. Dr. Katya believes that mental health best practice come through knowledge and care. So may I now request Dr. Katya to start her presentation, which is on how to protect your mental health during COVID-19 outbreak. So over to you, Dr. Katya. Dr. Katya, we cannot hear you. Can you unmute yourself?
Good afternoon, everyone, and thank you for your kind introduction. And I'm very grateful to be able to be a part of this important webinar. And my topic today is about how to protect your mental health during COVID-19 outbreak. And it's really important and also up to date right now that seems like the mental health issue is the after effect of the spread of the COVID-19, and I think it's our duty to be able to be prepared, to be able to help our friends to be able to move on with their life after the pandemic. And before I'm sharing with you the knowledge and experience on what I find in the research and the practice, I would like to go on a little bit on the definition of the protection. But let me move the screen away from the screen so I can see the screen myself. Okay.
Sorry to interrupt. We can't see your presentation just
Everybody
yet.
see the screen?
Not yet. I'm going to send them invitation again. Hopefully, if you press share my screen now, we should be able to see it.
Yes, I did. And if everybody else saw the clothes hanging behind my back, it's not my closet. It's the background of the office. So did you see the screen now? Yes, you did? All right. Now, like I said, I like to begin with the talking about the concept of protection, and then I'll go on to explain more on the research findings of what is protection and how to protect your mental health during COVID-19 outbreak. Now, the protection and prevention seem to be the word that people use interchangeably, and I will do the same thing as well. And sometimes I will talk about prevention, and sometimes I'll talk about protection, but I think that people can see the overlaps of the concept. But the concept of prevention is very helpful for us to be able to understand the way that we can do to help protect the mental health. Prevention, people say that usually it's come before protection, and it means to avert the threat before it occurs. And for the protection, people said that it's the next step and usually takes over if prevention fails. So, if you want to prevent something from happening, then you have to do a lot of things, right? To prepare, you do the have a good health, you have a good meals, and you have a vitamins. That's a prevention. But protection is when the threat is already coming toward you and you don't want to be affected by it. So protection is, people understand as it's the danger is coming close to you. Now, prevention in the field of the medical will explain that they have a 3 level, and these 3 level of prevention also being applied in many of the psychological intervention. So I will explain 3 things, and I think many of us may already understand that the level of prevention. The first is the primary prevention, which is designed for the people who, normal, quote unquote, people who are not affected yet by whatever we're trying to prevent from. For example, if we talk about COVID, there'll be a mental health that affected by COVID. That means the person is not affected or doesn't have any mental health problem or disorder yet. And the second of prevention is secondary prevention. For the people who are maybe have some pre-existing condition of other mental health already, maybe have some type of depression or anxiety or other psychological disorder, and also they might have other factors that make them prone to have mental health issue. For example, some type of family issue, the social problems, economic problems. Those kind of factors are risk factor for someone to be affected by the mental health when the pandemic came. And the last and the final prevention is tertiary prevention, and that is the design or is target the people who already affected by the problems. In this case, the person who already been having some type of mental problems or mental disorder causing by the COVID-19, either directly or indirectly. And the prevention at this stage is meaning that to be able to manage the problem from the problem to not getting worse, or to slow it down, or to stop it altogether. And also some people will explain about as a relapse prevention. So these 3 types of preventions, I like to use it as the view so we can look at how to, if you want to protect mental health disorder or problems during COVID-19, we are looking at the people in different stages. Some people may not have it yet. Some people may have a high risk of being affected by it, and some people already have it, and how to protect them from getting worse and not having to relapse to the symptom when they are already being treated. And the pictures show, I like to share with you this interesting skull opening. If you have the skull closed, it's called prevention. But if prevention is not work, then you have to use umbrella to protect yourself from rain. So that's kind of a concrete explanation of the difference between protection and prevention. But again, the definition of to protect is to keep safe, to defend, to guard, prevent harm from coming to, and to also including promoting. To keep safe is you have to look into some risk factor, like I said, the social, economic, relationship, family, or even biological factors that you may be born with, like risk factor on genetics, something like that. So you have to look for something that you can prevent as the risk factors, so you can defend or to guard from that risk factor. But to promote mental health, you're looking more forward to some type of psychological wellness. You know, you do something that you make you strong, and then you hopefully, when you have a strong mental, then any problem coming to you, you'll be able to sustain that. So to protect can mean prevention and protect at the same time. Now, the concept of psychological wellness also is important, and I'll be touched base on that a lot at this presentation, because it's related to the best practice on protection for mental health disorder. Psychological wellness, people find that it can provide significant protection against the likelihoods of major psychological disorder. And maybe it seems like, well, it's common sense. When you have a strong mind, then whatever bad thing coming to you, you'll be able to sustain, and you'll be able to prevent yourself from being depressed or being attacked by it. But it's good to see that research finding also show that as well, not just because some people say that. And for the mental health, what is the mental health that we're trying to protect? Mental health defined as the state of mental well-being, which is people can cope well with many stresses in life. So meaning that it doesn't mean that people doesn't have stress. You have a good mental health, you may have some stress, but you can cope with it. And you realize the potential, and you can do productive thing, fruitful thing for your life and to your society. So it's very good to understand mental health in the way that it's not 100% free of stress. And mental health problems is normally occur to everyone during the course of life, and it can be mild, it can be time limited, stress, or it can be sustained or long term. It depends on many of the factors. But mental health problems can happen to anyone in any times in their development. And I like to point out the important message here is that when we talk about, especially the country where it's not well developed in healthcare or mental health care, which is a majority of the country in the world have that, including Thailand. When you talk about, well, there has a dangerous disease coming over to the country, what's the first thing you have to do? You have to protect people's health first. Mental health come after. So, and many research and also the WHO already pointed out very clearly in their meeting in January 2021 that public health emergencies may be a significant risk factor for mental health problems. So while you're trying to keep people safe from COVID, you already create mental health disorder on people. So those kind of things that we have to remember. And the WHO also said that mental health is one of the most neglected area of health. And so people has rights to be in good health, and health meaning including mental health. As I always emphasize on people who are not working in the field of mental health, health and mental health is the integrated thing. And social restriction also can increase some type of behavior problems, which is become a vicious cycle. For example, one research, the WHO pointed out that social restriction that's related to pandemic, that people want to do social isolation, can cause increase of alcohol and substance abuse, online gaming, online gambling, many people in society. And when you're using alcohol and other substance, it will interfere your ability to take precautions against infection. So, by the way, you want to protect people from getting disease by having people to have social restriction. So they get stressed, they drink alcohol, and when they drink alcohol, they're easier to get infected by the disease. So it's kind of the thing that sometimes people forget, but it's happened, and including domestic violence also increased with this restriction as well. And why the COVID caused mental health issue and mental health problems? It's not directly to the disease itself, but the unemployment, the financial problems, the missing of education and lost their prospect in life, social isolation, you know, and when you come in close to in the family, they have a cabin fever, which is mean a lot of people stay in the house at the same time and get frustrated and get violence. And that's the normal of human reaction to stress. Fear of life, people lost their loved one during the COVID, and those are indirect and direct effects caused by COVID. There are many research also show that people who got COVID also have some type of neurological disorder afterward, and a long term of some type of mental health, and there's many research showing that as well. That's as a direct effect. And especially people with the pre-existing mental or neurological or substance disorder, they got worse. Their symptom exacerbated, according to the research, you know, and increased risk of cognitive decline when you have to stay inside and not having physical activity. There's no intellectual stimulation. There's no social interaction. Can cause that in and dementia in older adults, and that's the research finding. So what can we do about it? You know, when we know about this, many research also show that there's a couple factors that can protect as a protective factors for mental health during COVID. One is the physical activity. You know what physical activity is. So exercise. What's the benefit of exercise and psychological well-being? Do I already understand? Now, second is the tragic optimism, which I will explain a little bit more in the next slide. Meaning that you have a hopeful in spite of your unfortunate situation, basically. Third is the gratitude. It's a pro-social emotion, and if you have that, then it can be a good protector for you. Number four is social support. You know, they found that people who have or are perceived to have, you know, it's really interesting to see the keyword. You can either experience or you can just perceive that you have social support of being loved and cared for or valued by others. You're already being protected. You know, that's kind of very good information to know. Number five is the nature connectedness, and I'll also explain a little bit more. Because when you connect it to nature, you have a more like a psychological well-being. These are found to be protective factors during the pandemic, over and above, meaning that no matter what social structural factors you have, including no matter how old are you, or your gender, or your social status, if you have these five factors, you'll be good. Right? And the positive health behavior, physical activity, I will not get into that a lot because I'm going to keep some time for later because already you understand this. But the tragic optimism, what it is, the researcher explained that is the optimism in the face of tragedy. In spite of pain, death, and guilt is a tragic triad, which is basically is summarized to be that suffering is normal to human life. And if we can accept it and we can see that in different ways and see that as the thing that is help us grow, for example, it goes along very well with the Buddhist religion beliefs in suffering, and people understand suffering, then we can stay with the suffering. Also, the optimism can really help improving quality of life and also subjective well-being. And so that is the keyword that important to have, as the research already find this is helpful. It helps you cope with a situation better. And also the another research also said that suffering may actually contribute to sustainable well-being. So we don't try to have people not suffer, but we need to help people learn to suffer better, basically. So it's that well-being is not the absence of illness, So people said well-being, you have to be healthy, you have to be happy, you have to be rich. No, well-being is just understanding, accepting as a normal human development. And the benefit of positive attitude, that's couple research also show that if you perceive, for example, the policy on social distancing, if you have positive attitude toward that policy, then you are likely to have less chance to infect by the COVID. And also you have better mental health, you have less anxiety, it's improved the quality of life. And so those are interesting. If you want to keep people safe from the COVID, maybe you have to target mental health or target the perception or the mind of the people before you target the ability to follow the rules, for example. So it's come hands in hand. And the gratitude also is important factors that the research show that is benefit for having good mental health, have to help people adapt better. And even the keyword said that post-traumatic growth. If you have the gratitude orientation, even though you may have some type of suffering or the traumatic event in your life, you can grow from that. So the community.
Dr. Katya, one more minute. Okay, please
Yes.
wind up in a minute.
Okay,
thank you.
The community also is the key thing that people think that is helpful. Nature connectedness, as I said, research find that the view of nature and contact with nature help buffer negative effect of lockdown and increase positive emotion. And being resilient is important. I will go through my slide very quickly. And in summary, you have, if you want to protect mental health from during the COVID, psychological wellness is a thing to focus on, not to sacrifice mental health for health, and try to engage some physical activities, practice strategic optimism, create and look for social support, and also learn to have physical and psychological connection to nature. So that would be my final words at this time. So thank you very much.
Thank you. Thanks a lot, Dr. Katya, for a wonderful presentation. Before we move on to our next panelist, I forgot to mention some housekeeping announcements. I'm sure that there are many questions which our audience have for the panelists, but we'll take up all the questions at the end. So in the meantime, but you can put down all your queries if you have any in the question and answer box, which you can see in the panel. And this webinar is being recorded, and the recording will be available both on the ISSUP website as well as on the ISSUP YouTube channel. And for all the participants, a certificate of participation will be issued via email within 48 hours of the webinar. So thank you, Dr. Katya. Moving on to our next panelist, Professor Frances Grace Duca Ponte. She holds an undergraduate and graduate degree in health education from University of Philippines. She has been heavily involved in designing and implementing substance use prevention programs as the director of the ASEAN Training Center for Preventive Drug Education since 2012. And in 2014, she became a global master trainer for the Colombo Plan International Center for the credentializing and education of addiction professionals for the universal prevention curriculum. And since then, she has been providing training to prevention coordinators and workers from a number of countries. She is currently serving as the assistant professor of the University of Philippines College of Education. And she also provides technical assistance to the Department of Education in developing preventive drug education policies, as well as the Dangerous Drugs Board in crafting the Philippine anti-illegal drugs strategy. So over to you, Professor Grace. You may start your presentation now.
Thank you very much, Dr. Alok. The pandemic made me experience a roller coaster of emotions. I was highly anxious because of the uncertainties. I was also a bit upset because I need to do remote teaching. I was happy because I don't need to suffer the daily traffic jam. and long commute. But recently, I lost a loved one due to COVID-19. I'm sure many of you can relate with my story. That's why my topic today is very relevant and timely. The first speaker talked about the theoretical foundation and research that includes all these important protective factors when it comes to mental health. My topic today would be the general recommendations and issues and strategies for reducing and managing stress during a pandemic or other stress-inducing situations. I hope that through this presentation, you would be able to explain the nature of stress, recommend ways to manage stress the holistic way, and practice some stress relief strategies. What I'm going to share with you are practical strategies that I usually do and share with other people, especially my loved ones and my co-workers. So let's start.
I think that you've pressed your mute button. Sorry, we can't hear you.
I would like you to assess your stress response generally. Is it positive, tolerable, or toxic? Positive stress response means that you acknowledge that you are stressed, but you also look at the positive point of it. One example is getting vaccination. That is a positive stress response. Then we have the tolerable stress response, wherein you experience serious temporary stress, but because you have supportive relationships, this buffer the negative consequence of response. And then we have the toxic stress response, meaning you are highly activated, and because you don't have protective relationships, the negative consequence becomes difficult to manage. I hope that through this activity, you are able to get a baseline information on your stress response. And I hope that through this presentation, I will be able to share with you some practical tips on how to be able to manage your stress. Remember, stress is necessary and inevitable. Actually, this is something that is normal as human beings to experience stress. The main point really is how to manage stress the healthy and effective way. So the first general recommendation is to understand stress and your reactions to it. So stress is actually part of our survival mechanism. Okay, our body reacts to any threat. And in order to understand that, we need to review the twin systems. We have the sympathetic nervous system and the parasympathetic nervous system. So when we face an imminent threat, the sympathetic nervous system or the fight or flight response is actually turned on. And that is one way for us to survive. The problem is because we are in a pandemic and this is giving us chronic stress. If our sympathetic nervous system is turned on for a long time, then it will have negative consequences on our well-being. So it's very important for us to be intentional in shifting our sympathetic nervous system to our parasympathetic nervous system, which is our relaxation and digestion mode. So how do we do that? Okay, so before I move on to the different strategies, another general recommendation is to identify the trouble spots. What are the triggers? And in the Philippines, we have a local study. You can see here the statistics. So out of 1,879 respondents, more than 1/4 said that they experienced moderate to severe anxiety levels, and about 13.4% of them had moderate to severe stress levels. So obviously, the COVID-19 pandemic is a major stressor. So maybe you can ask yourself at the moment, beside the pandemic, what are your major stressors? In another study, among the COVID-19 challenges include pressure from work and family responsibilities, financial losses, grief and mourning due to loss of loved ones, and loss of opportunities. And the last general recommendation is for you to use a holistic approach to managing stress. So here we have the wellness wheel, and there are 7 dimensions that we are going to discuss. I'm happy that the first speaker mentioned the general protective factors. What I'm going to do is categorize them into the different dimensions of wellness. Starting off with the physical dimension. Exercise is very important. As they say, exercise is the best antidepressant. And there are a lot of research saying that it really works. Aside from movement, with 20 to 30 minutes of physical activity daily, you can also do a lot of relaxation activities. Do something that you enjoy. Go back to your hobbies. And then get enough sleep. Improving our sleep hygiene is very good for our mental health. So get 7 to 8 hours of sleep each night so that you wake up energized and rejuvenated. And third is mind what you eat so that you will be cautious to avoid stress eating. It's not only the quantity, but the quality of food that matters. And also you need to stay hydrated. The second dimension is social. I am actually promoting physical distancing, not social distancing, because we need to be intentional in connecting with people. Isolating yourself, especially during an adversity like COVID-19, is actually unhealthy. So be intentional in nurturing your relationships, staying connected, and finding support in others. Seek assistance if needed. For the intellectual dimension, we all know that aside from the pandemic, we are also experiencing an infodemic. So face up to the facts. Click. Before you click, you think first. There are a lot of misinformation and a lot of fake news, especially on social media. So go back to the primary source of the information and be critical about it. The second is to mind your mental traps. These are cognitive distortions. Like when you think that you are solely to blame, you're using personalizing, or maybe you are thinking of the worst case scenario. Those are the things that you need to be mindful of. And you can use the real-time resilience strategies like going back to the evidence and coming up with a plan. What do you do when this happens? And lastly, get creative. There are a lot of approaches. You can use arts and crafts, music, drama. There's really no limit to our imagination. Next dimension is emotional. Give thanks. Have an attitude of gratitude. To be humble and more compassionate, we need to be grateful. So have a gratitude journal. And it's also important to schedule worry time. What do we mean by this? Set aside a particular time for you to think of your sources of stress. Okay, what are the causes of your anxiety? Think of those things given a particular period of time. And then after that, free up your mind so that you can focus more on productive activities. The third, which I find very practical and very helpful, is the community resiliency model. I share this with my friends because I find this very effective. The CRM, or the CRIM, is actually a trauma-informed, skills-based approach in resetting the natural balance of the nervous system by focusing on sensations of well-being. And it has 6 skills. The core is the tracking skill, wherein we listen what's happening within. We listen to our body, okay, and monitor the sensations, whether they are pleasant, neutral, or unpleasant. Then we have resourcing. This is where we explore what are the internal and external resources that we have that would shift, okay, that would help us go back to our resilience zone. So for example, under the internal resources, we have the good experiences, we have the positive characteristics or qualities that we have, happy memories, and then for external resources, we have people, places, and events, okay, that bring out positivity. And then we have grounding. This is a skill wherein you will have to be mindful of the present and supportive structure. Like, for example, you are standing against a wall. So you really think of that, feel that sensation, And another example is when you take off your footwear and just feel the ground. So that is literally grounding and really thinking of the present. Gesturing is being intentional in our movements, so that we have calming gesture. When you do a self-hug, that is part of gesturing. And then help now are strategies that we can do immediately. So for example, drinking a glass of water, that is a strategy that you can do right now. Or looking at the various colors and shapes around you, you can also take a walk backwards. There are a lot of things that you can do now so that you can go back to your resilience zone whenever you are in your high zone or your low zone. And then lastly, we have the shift and stay, meaning doing all of these strategies, you go back to monitoring what or which parts of your body have pleasant, unpleasant, and neutral sensation. And then you intentionally choose to stay in your neutral or pleasant sensation body parts. Now let's move on to the environmental dimension and turning to nature. We all know that nature heals. So having enough sunlight, hugging a tree, okay, gardening, all of these things are good for our wellness. Declutter our home and habits and take care of your personal space. There are a lot of research saying that when we have a comfortable and secure workspace, that is good for our well-being. It lessens the stress that we are feeling. For the occupational dimension, I suggest that we make a stress journal. Many of us would agree that one of the major stressors is really work. So monitor sources of stress in the workplace. What are you doing about it? And then assess whether it's healthy or unhealthy. Then improve your work habits to increase your energy level. For example, you can make use of productivity tools. My favorite example is eating that frog first, meaning doing the most difficult task first thing in the morning when your energy is at its highest. Okay, you can also make use of Pomodoro technique, right? So there are a lot of tools that you can use to increase your productivity and to manage your energy level. Then practice work-life balance. And it's not 50-50. As long as you're happy, as long as you are satisfied with what you are doing with your personal and professional life, and that is work-life balance. And it has 3 dimensions. Self-care is the first, meaning very important that you invest in self-care first. And then you take care of your relationships and your work, of course. The spiritual is finding your purpose. Go back to the why. Because when we go back to the why, then the other questions become easier to answer. Why do you do this? Go back to your purpose. Enhance your sense of inner peace and make time to reflect and meditate. So at this point, I'm going to share with you my personal stress relief kit.
Professor Grace, can I interrupt you here?
Yes.
You have 1 more minute to wind up.
Yes.
Thank you so much.
Thank you so much. So my stress relief kit include, okay, this is my stress ball. So for my physical dimension, for my spiritual, I have a rosary because I'm a Catholic. And then I have here, okay, my family. For my social health, I intentionally connect with my loved ones. For my intellectual dimension, I have here my stress journal, my gratitude journal, sorry. And then here I have an image, okay, for my environmental dimension, because I love to travel. I have rubber bands for my emotional dimension. This reminds me that I am flexible and that I can bounce back from an adversity. Lastly, for my occupational dimension, I have occupation saying, it is never too late to be what you might have been. So in a nutshell, stress is inevitable and necessary. Managing stress starts from understanding its nature and improving our self-awareness. And there are practical strategies to help us manage stress holistically. Let me end by sharing with you the power of ease. Embrace stress as natural Explore the various internal and external resources that you have to manage stress and empower yourself so that you can thrive. Thank you for listening.
We unfortunately we can't hear you at the moment. Could you just mute and unmute again?
Yeah.
Oh, now
I hope
now we
I'm
can.
audible now. That's okay. Wonderful. So thank you, Professor Grace, for your presentation. Our next panelist is Miss Leah Mapong. Uh, she works in international development programs, particularly on gender, disability, and social inclusion, and monitoring, evaluation, and learning. And for the last 15 years, she has worked in various capacities on economic and social development issues in challenging developing setting in Indonesia. She's been working with the United Nations and the Australia government aid programs under the Department of Foreign Affairs and Trade for Indonesia. She holds 2 master's degrees from University of Indonesia with a major in economics and public policy from the University of Melbourne, Australia, with a specialization on social policy. And she's also received the prestigious Australia Awards Scholarship Program in 2012, currently working as the uh, gender education advisor for Australia and Indonesia Partnership for Justice. So, Ms. Leah, you can now begin your presentation.
Okay. Thank you very much, Dr. Alok, and also thank you very much for Olivia for helping me presenting my presentations. So thank you everyone, and good afternoon, selamat sore from Jakarta, Indonesia. So I will try in this 15 minutes. I'm hoping that I can give you a brief of descriptions about what Indonesia women struggle during this pandemic, especially in relations to the women mental health and also violence against women. If time permit, I will also share best practices about women resiliency during the COVID-19 pandemic in Indonesia. So next slide, please. So in the right diagram of my slide, you will see that this is the highest peak of COVID-19 cases in Indonesia, which is on July and August. I will talk later a bit on this. So we called this as the second peak, yeah, while the first peak was in between January and February, also in 2021 this year. Next slide, please. Yeah. So on this, women and the pandemic, I believe that many of us has been greatly affected by COVID-19.
Unfortunately, there is a lag in the slide and what you're presenting. So the slides are actually changing much later.
Okay. Yeah, sorry. Yes, this
Yeah.
slide, please. Thank you, Dr. Alok. And yes, Olivia, this slide. So on this women and pandemic, I believe that many of us has been greatly affected, yeah, by COVID-19, from longer work hours and also decrease overall physical and mental well-being, just like mentioned by our 2 presenter. And we also might be loss of job, closure of school, travel bans. Dr. Grace mentions that she enjoy traveling before, movement restrictions, and much more. But what I would like to highlight here that the impact of the pandemic is not natural, but heavily influenced by the social constructions, which is control access and resources to adapt and also to survive. Some group of people have been more affected than others. For example, women, people with disability, and also the elderly. And not everyone in every place will be affected in the same way. So in Indonesia, just like probably in many other countries, the effect of the COVID-19 to women and men are also different. UN Women just released their report about 1 or 2 months ago, and their findings are exactly the same with our finding when we conducted our study in 2020. That although men they have died more from the virus, but women mental health has suffered a larger setback. Next slide, please. Next slide, please. Yes. So this is our publications from our joint study with the Indonesia National Commissions of Violence Against Women. We supported the national commissions in 2020 in conducting series of survey, thematic studies, public consultations to portray the gender dimensions of the pandemic, because we believe the pandemic is gender blind, but there are gender dimensions in the pandemic. So we help in conducting the meta-analysis of those different data sets, and we publish this report along with the policy brief and also a couple other knowledge product. So our study confirmed that the impact of the pandemic is serious and long-standing, and that there is a high level of uncertainty for not having an end in sight as how to the crisis is managed in Indonesia and when it is going to be over. So the pandemic has shaken the very structure and system of the society in our country. So in short, it's slowing down all the target sets under the SDG goals. It is not only impacting our health, but also the economy, education, poverty alleviations, gender equality, the environment, and many more, including mental health and well-being. Next slide, please. Yes, next slide, please. Okay. In this slide, from the various study, also including from our study, that during the pandemic point to concerns is also around poor mental health and well-being. So the spread of COVID-19, it increased stress, burnout, fear, anxiety, depressions, like the presenter was telling us before. But in Indonesia, it also affect more to women and men than men, yeah. And our study also highlight that this mental health effect, they actually highlight more or facing by women in the sandwich generations more than those are not in the sandwich generation. So what I mean by sandwich generation is those women who are married and with children, and they have to taking care of their elderly parents or their parent-in-law, yeah. Of course, there are also reported cases to increase of anxiety among working women living in urban cities, but compared to women living in the rural. But again, I don't have enough data about this. Again, back to the study that we do, many experiencing challenges with school closures and also lack of childcare. This is also affecting women more with children. They are more likely to report symptom of anxiety and also depressive disorder. Yeah, and on this, also the evidence shows that many women in here, they've been more likely to step up with teaching, instructing, and also training their children. So that's why level up the anxiety level or depressions. Women are also experiencing twice as many work shifts at home due to the additional tasks of accompanying children when studying from home. The school from home policy force women to learn online technology, online learning technology for the children, and also requirement of healthy and safe lifestyle, food nutrition necessity during the COVID-19 pandemic. So they have to spend excessive amount of time and domestic work. So in our study, it highlights that 1 in every 3 respondents stated that the additional domestic and care work has led to increased level of stress and burnout among them. Just for illustrations, that the Indonesia second peak of COVID-19 cases, as I mentioned before, was in July to August this year. Yeah, this is right after the Eid Islam holiday in May, and also this was after about 1.5 million of people defied a domestic travel ban. So in July itself, the total death in Indonesia, it's amount to 35,600 people. And then in August, it jumped to 38,900 people. So in here, women, they are the one who more dealing with sick family member and caring for them, which is already adding the already expanding care and also domestic workload. Yeah, I will talk a bit again later. So those factors coupled with anxiety over job and also income loss and the effect of lockdown on gender-based violence, this also contributing to the disappropriate worsening on mental health among women. Next slide, please. Next slide is talking about, so apology about this technology. It's a bit slow down in, yeah. Next slide, please. Yeah. This is what I describe as a situation like a war-like emergency in Indonesia, especially in between July to August this year. Next slide. The next slide. Yes, the next slide is also describe about when people desperately pleading for help to get oxygen tanks, refills, and also hospital bed for their family and friends. Uh, you will see in this photo that one of the locations is actually very close to my house in South Tangerang or in Tangerang Selatan, yeah. And this situation is also happening to me during that period of time, where I feel that time that death is just down the street, so close to us. It feels like we are under attack by the virus. And during that time, several within an hour, almost all day and also all night, up at night, I can hear the ambulance siren passing our house. Many people also hear the same, and which all lead to social anxiety just by hearing the ambulance siren. I remember in one of those days, what I was doing was just calling and calling, I think to almost hospital surrounding Jakarta and South Tangerang, seeking, begging for bed and room for my auntie, from my dad's side, for my best friend mothers, and also for my cousins from my mom's side. At the end of the day, I remember I was sitting in the floor. I was crying, exhausted. I was feeling useless and also hopeless that I cannot get any bed and any hospital room, not at all. I remember I was mad that time. But I was not alone. Not only me feeling like that, yeah. Another female cousin of mine on the same time, and she's a single mother. She's also feeling depressed that time because within a week, she must taking care of her two sons, her mother, her older sister, and the husband with their two kids, whom all are infected by the virus. I remember she was telling me she's driving all over the city just to find rent house for temporary isolations because hospital and hotel all are occupied that time. She also need to search for oxygen tanks and refills for her sister. And at the end of the week, she must accept the fact that she lost her mother while her sister is on critical conditions. So that was a very difficult moment for many of us, including myself. Since the beginning of the pandemic in Indonesia, which is starting March last year, I have lost some. But this year, if I can count it, I lost more, maybe about 50 of people that I know very close. I lost them, yeah, because of this virus. So many of them, they died because of the virus, but also some died because of other illness. In regard of those non-COVID death, many reported and complained on the decrease of quality of service delivery during the pandemic. Everyone is exhausted and drowning, including our medical professional and also other service provider. Next slide, please. Yes, this picture is talking about the death in family, which is in my family. So this is during the funeral of my elder sister. She's a single mother for my niece and my nephew. The girl holding the pink bouquet flower is my niece, and next to her is my nephew. Both of them are still on their teenage. Yeah, they lost their mother also because of this virus. What I would like to share here, the effect of this pandemic to children and teens are not been widely discussed in a discourse, especially in Indonesia. But UNICEF has reported that there are 250,000 Indonesian children. They lost both of their parents during the pandemic. So these younger generations are the one who will be most suffered and affected with this longest and darkest period in our lifetime because of this pandemic. In addition to mental health support, this can be worse as Indonesia has a severe shortage of mental health practitioners. With a total population of 260 million, we only have about 773 psychiatrists and 451 clinical psychologists. So simply, it is not enough at all. Next slide, please. Yes. Here, again, according to our study, the frequency of violence against women also increased in Indonesia since the onset of the crisis, particularly among those who are married, aged 31 to 40 years, and those who have income fall below 5 million rupiah, or about 350 US dollar. And this is occur in the private sphere or at home. So the study confirmed that home is no longer a safe space, especially for women. What is also important for our attention here is the increase on gender-based violence, which is 3 times higher during the pandemic. And this including revenge porn or intimate content for revenge, sextortions, doxing or distributions and sale on personal data, non-consensual posting of sexual media, cyber stalking, harassment, and also online threat. Yeah. So the lockdown and the movement restriction affected the quality of service delivery, including to inadequate institutional response. Many service providers for victims of violence, they are finding barriers to business continuity, having to limit their activity due to a shortage of funding or safety concerns. Yeah. So again, in regard of legal support for the victim of violence, just last week I organized a webinar with the topic of violence against women during COVID-19 in Eastern Indonesia. So some of our resource person told us that women, especially with disability, they find even more hard difficulty during this time to give them justice. Yeah, even though the regulations are there, but the implementations of our criminal justice system is not responsive enough, not fair enough, and not yet inclusive for women victims of violence, especially also for women with disability. I will go to the next slide. This is about the dating in violence, because I think you can
Ms. Leah,
Yes.
Ms. Leah, can you wind up in another minute?
Sorry.
Can you wind up in another minute or so?
Yes. Thank you, Dr. Alok. So the other things that I would like to say here is the increase on dating violence. There are some cases that I would like to share here. This is the story about Indonesian women, Novia Widiasari. Yeah, she's 20 years old from Eastern Java. In the early December, she committed suicide beside her father's grave by taking a mixture of potassium. Novi is a victim of rape and also sexual harassment by the police officer, who is also her boyfriend. Yeah, she dated this guy when she returned home because school was closing. In the story short, when she facing this dating violence and also sexual violence, she received no support from everyone, including from the police. So she feeling lonely and depressed, she decided to end her life. Yeah, the story is now become the viral in Indonesia. The next slide, please. The other 2 things that I would like to say is also about women victim of violence during the pandemic. And one of the cases is involving Islamic religious leader who raped about 21 of his students. Because they live in a boarding school, and because of the pandemic also, that the security, the parents of the children could not visit the children, and they become the victim of violence of these Islamic religious leaders. So from sexual violence, it goes into modern slavery, and it also lead to the forced marriage and child marriage. Yeah. So this is happening because of the pandemic. What I would like to talk also about the child marriage during the pandemic, this is also another form of violence to girls. Girls who been forced to marry at their young age, they have they experience multiple spectrum of violence, sexual, emotional, psychological, and also damaging the futures of the girl. So those victims, and also with the lack of support from the government and those who need to support them, this is a lead to a significant high rate of depression, sensitivity, somatizations, obsessive compulsive symptom, anxiety, and many more. And if there is no support effort given to them, so what we have to remember here that we nurture and we live with a traumatized generations of women, or generasi yang trauma in my language. Yeah. The next slide is more talking about the resiliency of women in Indonesia, but I think the two presenter already talk a bit about how we can deal with the stress and also with the mental health during this COVID-19. Thank you, Dr. Alok. I return the floor again to you.
Thank you, Ms. Marpong, for your wonderful presentation highlighting the disproportionate impact of the pandemic on women. Our next speaker is going to talk on recommendations for action to address mental health provisions. Dr. Arun Kandasani. He is additional professor of psychiatry at Center for Addiction Medicine at National Institute of Mental Health and Neurosciences, India. And he specializes in the treatment of addictions, especially behavioral addictions, and has a special interest in psychosocial interventions for addictive disorders and physicians and mental health. Several national and international publications, and has conducted a number of research projects. He has been awarded the Tilak Vancouver Rao Gold Medal in Psychiatry by NIMHANS, and has a number of other awards to his credit. He's also the chairperson of the Indian Psychiatric Society Task Force on Doctors for Doctors. So over to you, Dr. Arun, to begin your presentation. We can't hear you, Arun. Can you please unmute yourself? Yeah, we can hear you now. Yes, you are audible now.
Thanks, Dr. Alok. Without much ado, I'll move into the topic. Greetings from my institute, and I'd like to put a disclaimer before talking about this topic as such. Like, see, the quality of material which is being published on this area is questionable. I don't want to be skeptic, but that's the truth. And most of the reports are opinion pieces, and most of the data are from regional areas. So generalization may be a little difficult. I'll try and push as much as possible from my side. This is a World Mental Health Report in 2001 had talked about this phrase is something which always ring my head. The task at hand is far from simple, and there are no magic solution. And it's 20 years down the line in the COVID situation also, the same problem prevails. The key challenges during this period which we faced are, especially in more hospital-based setting, mental health establishments are difficulty in isolating and quarantining patients with active symptoms of severe mental disorder. Also, many of them, it's very difficult to make them cooperate during swabbing and testing. This is true even with people who come with deliriums and in severe withdrawal states. But they have to be treated over here. They have to be sedated over here, and some form of treatment is initiated. It's quite a lot of stress for the staff also. And the staff has to be in close contact with people who have a significant risk of violence or suicidality, and keep checking on them frequently, which is also against all the advice that, like, okay, you should keep the contact minimally and all those things. It's very difficult over here. Many times the patients are uncooperative, and at times they're hostile also. That's due because of their symptoms. It's not that they want to do it that way. And homeless people are being brought all the time into the casualty for treatment, and then you don't have any kind of proper history to them, no history of any contact which could be established over there, and no reliable informants and no ID proof, even to raise a testing to be done also. You don't have anything over here. Like, these all were real challenges in the ground. Poor affordability to treatment due to loss of livelihood was very evident with some of our paying patients as such. Like, sudden prohibition of alcohol led to huge caseload of complicated withdrawal states coming to the casualty. We were started with people coming with complicated withdrawal states in form of deliriums and seizures, and non-availability of OST, because that's only available in specific places. People were not able to reach out to those places because of their lockdown as such, and that led to relapse into this street drugs also. And again, due to lockdown, there was poor access to consultation and treatment for people who are already ill. And many times, patient and the party don't disclose their COVID status due to fear of isolation and the stigma around the whole COVID things. So having said all these things, I was thinking like, oh, what am I going to talk newly on the recommendations part of it? There are quite a bit of things which is published. And what I realized is, which is in keeping with this phrase, the important thing in science is not so much to obtain new facts as to discover new ways of thinking about them. And I'm sure you all will agree with me that none of the factors which have been talked about in terms of the risk factors or the resilient factors, the treatment factors, the recommendations are new. Everything was there in the setting. Maybe it has to be applied in a larger scale. That's why there is a lot of mushrooming of publications which have come up, but then it needs to be tailor-made for the need of each place as such. So let's move on to the recommendations. I don't have much thing like. The first is a very generic recommendation. As you all know, there needs to be a hospital infection committee which has an idea about what to do with people who come with mental illness and risk of COVID, and also ensuring adequate human and other resources, which means in human resources you need to keep rotating people in duty, and in other resources in terms of having PPE kits and masks and hand sanitizers. All these things need to be in place. Training for all the personnel on COVID care, especially the safety protocols per se, disinfection and waste management protocols, and the training on that it was very essential, and developing IEC materials on the basic mental health care, which was already available, but people put together and brought it for the manuals per se. In the OPD setting, the recommendations were like, I'm talking about what recommendations which has been followed in our setting, and I'm sure we can discuss about further things later. Encouraging only appointment-based OPD consultation to prevent crowding, and making the seating arrangements in such a way that the place is well ventilated and physical distancing norms could be followed, and also there is restriction in too many people entering into the waiting space, one patient and one attendant to be there in, and also what we realized that prescription for longer duration was to be made, and that was done also. Referring patients to the nearby district hospitals. We have a district mental health program over here, and it worked well during this period. We could refer to the DMHP program, and also encouraging teleconsultation for follow-ups to reduce the footfall in the hospital per se. And the provision for telemedicine and telepsychiatry services shall be instituted. Also, wherever it is available, it should be used adequately. And proactively calling the patients who are due for consultation and providing the care wherever it is possible was also something which had helped us. Especially in addition, we do have an electronic database where we could get the details of people who are to be followed up in the next 1 and 2 months. So we were able to call all of them individually and able to provide some bit of care, whatever is within our reach, we could do that. And whenever there is a patient of either patient with mental illness having COVID-19 or the patient who's having COVID-19 developing mental health issues, it was always important to have multidisciplinary care where both the general physician and the psychiatrist join together and do their intervention, because both the pharmacological intervention and the psychosocial intervention, and not only psychopharmacology, the general pharmacological intervention also should go hand in hand with between these two physicians. The generic advice to patient and caregivers which need to be given during this period where should not stop any current psychotropic medications, and the caregivers should make sure that the compliance to the medications has been adequately ensured, because if there is a relapse during that period of time, it was becoming very difficult to get a care. Even getting a vehicle or an ambulance to reach out to the hospital was next to impossible, and even if they come, the beds availability was also a problem. So ensuring the compliance to medication was very, very essential, and it was pushed. And also the caregiver, whenever the patient doesn't have insight and not able to follow the instructions in terms of COVID safety protocols, caregivers as much as possible have been asked to ensure the safety measures as possible as such. In case of a new onset psychiatric symptom, there was also a possibility to consult hospital over teleconsultation. Encouraging utilization of teleconsultations for routine follow-up has been made in the hospital, and unless there is an acute emergency, to have this follow-up over tele method has been encouraged. The physician who is treating the person with mental illness for COVID-19 also has to be informed about the psychiatric treatment the person is receiving. Many times there was a confusion about this also. In terms of recommendations for the inpatient care, was all patients and caregivers had to be tested before inpatient care, because we admit people along with the attenders, and the risk assessment needs to be done regularly for triaging the patient care, because we wanted to keep the stay as shorter as possible and intensive treatment during that period of time, and handle the crisis and give them a clear aftercare at home. And then there was also a 24-hour hotline which could address the concerns of people who get admitted and go out of the hospital at the earliest. And also it was policy to avoid elective admission during the COVID peak crisis as such. And caregivers had to be consulted adequately, and in case the caregiver is not around to stay with the patient, then they had to be repeatedly called and updated about both physical and mental health of the patient per se. And the aftercare service had to be effectively used. It was quite useful because we could get a lot of information about the well-being of a patient. Some of the patients who relapsed after a long period of time could be counseled over online also. In the emergency facility, again, the crisis intervention team had to be there all the time, and there was also a continuous liaison between the actual COVID physical the physical symptom management team and the psychiatric symptoms management team all the time. And there were preparedness to large volume of patients over a short period of time, especially when the prohibition happened and alcohol was not available. And again, here also we insist on shorter stay but intensive treatments, both on rapid tranquilization and rapid detoxification. And there was a 24-hour hotline for aftercare too. Now, all these things were attached to a mode of telepsychiatric consultation. And there are 3 modes in which the telepsychiatric consultation worked. Some of us were doing direct to patient, which was video consultation, directly used to do the triaging part of it, where the patient should go, when the care should be given, or the screening part of it, and providing the first consulting services. Also, aftercare and follow-up services also have could be done during this period. Earlier, we didn't had a clear protocol about the psychotherapy over online platform. Then this is a period where we rewritten our protocols for how the online psychotherapy needs to be happening. The other method was a collaborative video consultation, where what was done is that from our hospital, we could actually use the people in the primary care to deliver the care at the patient's end itself through a collaborative mechanism where it's at the patient's space. And the next one was the home consultation, which was possible, had to be done for some people because they were not able to reach out, and there are social workers and ASHA workers who were nearer that place, and they could go over there and deliver the medications and also able to provide as much as care as possible. And this was through a guidance from the team which was sitting in our center and was being done. There was also a huge push for the delivery of mental health care in the community, because this has to be both promotive, push both promotive and preventive measures per se. A lot of it has been spoken already, so I don't want to go much into that. IEC materials to spread accurate facts have been developed. I will share the platform which has all the IEC materials which we have developed and the manuals which we have developed in the presentation itself. Active liaison with NGOs and volunteers who work in the field of mental health was very useful, and that could ensure the regular supply of medications. And building the local care structure in terms of education setting, panchayat raj setting, and primary healthcare setting was also useful. Ayush healthcare setting was also useful. All the patients and caregivers need to be, they have been encouraged not to visit OPDs unless there is emergency. And in case of difficulty in procuring medication, they have been given contact numbers from the local, state, and national helpline services where they could like. And arranging mobile clinic was also useful. Some of our people went and deliver medications at nearest hospital where the patients can. I'm sure Dr. Alok also has a rich experience about delivering opioid substitution treatment method at the doorstep of the patients per se. And also, we feel that it's an opportunity to establish or strengthen the community-based mental health services per se. Again, the others were creating, launching audios and videos about self-care and other aspects, and also printing manuals in the management, which could enhance the capacity of the healthcare provider community. I'll not go into the details of it. There are a variety of people who are vulnerable, and they need to be picked up, and appropriate attention needed to be given to them. As it was spoken earlier, connectedness as a major strategy, which I have felt useful, and I would say that Katyani, what she has said also is very essential. It is not about connection to connectedness to outside. It's also about connectedness to self, which was very essential over. These are some of the manuals which we have created, and this is a link which is there. You can make use of it to download some of these things. To conclude, it is essential to ensure a continuity of care during this period. Tele aftercare services were very useful, and I'm sure that's going to be useful in the future also. It gave us an idea that we need to build the capacity of the community to improve the accessibility to mental health care, and also the decentralizing the care from tertiary care center to the primary care center. Thank you. Dr. Alok, we can hear you.
Oh, thank you so much, Arun, for both reminding me that I'm on mute and for your presentation. So we have now wrapped up all the 4 presentations by our panelists. And if there are any questions from the audience, we'll be happy to take them up. There are quite a few already, so we'll go through them one by one. Any comments or questions, you're most welcome to ask in the questions box in your panel. So I hope all the 4 panelists are available to answer it. Kamal Krishna Banik. So they're all comments. There is no question in them. Thank you very much for your comments. He's found the seminar extremely encouraging. And there is a comment from Mr. Neeraj Bhandari, very knowledgeable session. Thank you for your comment. And as far as the questions are concerned, okay. So, okay, there is this question about certificates. So, as I already mentioned, that participation certificates will be mailed to all who attended this session within 2 days, 2 working days. You will all receive your certificates of participation. Then there is a question by, I think, Olha. Did the access to mental health services change during the quarantine restrictions? So, who should I address this to? Okay, maybe Arun, you can take this up.
Sure. Definitely, it has changed. Quite a bit of the centers have been closed during the period of time, and most of the mental health care setting has been converted into COVID care facilities. Also, the number of beds have been reduced, and because there was a need during that time for the COVID-related thing, so that was given the most important thing. Also, the healthcare sector has been shifted towards the care of COVID. So the grassroots level workers who were supposed to deliver the care of mental health also were not available immediately. Even in many of the mental health care settings, also in state governments, they have been posted to the general hospitals where they had to take care of the COVID patients. So obviously, there was a deficit in mental health care accessibility and accessibility. Also, the medicines were
Thanks,
not
Arun.
available due to lockdown.
Some of the medicines related to mental health are concerned, they're not widely available in the pharmacies outside, and the availability is restricted. That is particularly true for treatment of addictions. So I don't know what's the situation in other countries. So if somebody would like to supplement that, because once the access to hospitals reduced because of travel restrictions, many of the medications were not available because they're only dispensed through hospitals and not in pharmacies. So was that something similar in other countries during this period? In Thailand, Philippines,
Yes.
or Indonesia, was the situation similar?
May I share some of the experience?
Yes, please, Dr. Katya, go
Yes.
ahead.
Yes. The couple of my friend is a psychologist working in the hospital, and at the time of COVID, they were assigned to be, basically day and night shift for other COVID patients. So they are being removed from their psychological services into medical services just because the lack of not adequate number of the staff at the health part. Yeah.
May I share a bit, Dr. Alok?
Please go ahead. I'm sorry. Yeah.
Okay. Yeah, I think in Indonesia, the situations is also quite similar. But what I would like to especially highlight that the person with psychosocial disability, I think they are the most affected during this pandemic because the counseling, the psychiatric, the psychologists, is become, as I mentioned before, the number of these mental health support are severe in Indonesia, but also during the COVID that their access to this mental health practitioners is getting even more difficult. From a number of complaint from a group of people with disability in Indonesia, they also mentions that access to the medicines is even getting worse and become rare. So that's, I think, additional input from me.
And Professor Grace, would you like to add anything to this?
Thank you very much, Dr. Alok. I guess in the Philippines, we share the same experience, but I can talk more on the university setting. So we have a lot of students currently experiencing different issues regarding mental health. And I think the stigma and discrimination is another major issue that should be discussed openly. Currently, the University of the Philippines is doing a lot of psychosocial support for our students. We are really giving them compassion, patience, a lot of alternatives for them because they are in different contexts and situations. I guess we all share the same experience.
Okay, thank you so much. So another question is, do you have any information on the level of specific substance on consumption increase during the COVID-19 pandemic in the Asian countries? So basically what is being asked is, do we have any specific study or any other source of information regarding the increase in level of consumption of various substances during the pandemic? So if any one of you has conducted any kind of work in this area, can you please share that briefly?
Dr. Alok, can I share? I attended the ASEAN Senior Officials on Drug Matters meeting last September, and most of the member states experience an increase in drug use, illicit drug use, and they say that there's actually a shift, okay, to cheaper drugs, but it's actually a bit alarming that despite the pandemic, substance use continues to increase, and maybe because some people choose to manage their stress through these unhealthy ways. So tobacco, alcohol, and worse, illicit drugs. And um, in the field of prevention, there is really a great need for us to step up and be more aggressive in really sending the prevention message, okay, because this is a global issue, really. It's a very complex health and security issue. And we need collaboration, okay, of the different member states.
Thank you. Arun, would you like to supplement that? I mean, apart from the anecdotal information that we have, is there anything documented anywhere?
Maybe you can add to be like, I don't think so. We have any documented nationwide uh, uh, established evidence to say that increase. Like all of us have individual experiences, such like the huge upsurge into withdrawal cases, and then again once the prohibition was lifted, it's a huge round of patients coming with lapses and relapses with alcohol happened. Like, and quite one experience which we have is that our rate of follow-up with OST has reduced to 20% after the lifting of the lockdown was lifted. People who have been regularly on OST haven't, at least 20% of them haven't reached back, which is something is worrying us, because we assume that they're not contactable, and there's an assumption that they might have gone back to whatever drug they were using earlier. Again, there are a lot of things on behavioral addiction as come up. Gambling and gaming, all those things, stuffs have increased over a period of time because of easy accessibility and availability and everything like. But again, there's no, I couldn't come across any kind of nationwide study which talks about increase in the rate.
Okay, thanks a lot, Arun. I don't really see any further questions in the questions box here. There are some comments regarding a couple of issues which I've been informed that they will be addressed directly by ISSUP through email. So and then they'll not be left unattended to. So with that, I thank all the panelists for their wonderful presentations and also very informative, engagement in the question answer session. Thank you all so much, and we close the session now. Thank you, everyone.
Thank you. Goodbye. Goodbye, everyone.
Thank you.
See you again
Thank
sometime.
you.
Maybe. Thank you. Bye.